a lot of doctors are starting to creep into aesthetics, and maybe the qualifications aren't there or the training isn't there. So I think it's important to do your research on the training, look up, before and afters, look up, sort of reviews of the doctor.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Aaron Fletcher, who is the founder and director of Georgia Center for ENT and Facial Plastic Surgery. He is a recognized authority in the field of otolaryngology, head and neck surgery, ear, nose, and throat, as well as facial aesthetics and reconstructive surgery, along with being an award-winning facial plastic surgeon. Dr. Fletcher's skills and expertise are sought after, and he has been featured in several local publications. He also creates and distributes health education content via Dr. Knows Better. He's been named both a top doctor and as one of the top 10 best plastic surgeons in Georgia. So Dr. Fletcher, welcome. Glad to have you here.
Thank you. I appreciate you, Daniel. Thanks for having me on.
Yeah, so let's dive right into it. How did you get interested in both ENT surgery and also facial plastic surgery?
So I went to medical school knowing that I was going to be a surgeon. I felt like that was my calling specifically, not just to be a doctor, but to work with my hands and to train my hands. So I had an idea that I wanted to do surgery when I went to medical school, and I just decided to figure out what I liked the most in terms of anatomy. So when I was doing my gross anatomy coursework, I just fell in love with the head and neck anatomy. It just has the most intricate anatomy in the body. You're dealing with, or at least in close proximity to the eyes, the brain, ears, the mouth, and there's a lot of nerves and blood vessels that course through the head and neck. And I just felt like it was really interesting real estate, so to speak. And I just wanted to spend the rest of my life working in that area as opposed to the bowel or like an orthopedic surgeon working on bones. I felt like it had a lot of finesse to it, and the areas that we operate in require a lot of expertise. So it definitely fit me the best.
Yeah. Now, when it comes to ENT, like it's interesting because like when people think about ENTs, like they understand, okay, ear, nose, and throat, but then like a lot of things that you specialize in, like sinus issues, hearing loss, allergies, voice, sleep apnea, thyroid, like when you think about it, it is all connected to it. But like, I think many people don't think about how it's there's so much that's related just to one specialty, just ENT. So, I mean, how did you kind of be able to get to the point where you're able to be a specialist in all these different areas? It's almost like 3 areas in one, but it's even more because everything's connected together. So, I mean, how are you able to like kind of keep up with it and make sure that you stay top with so many focuses?
Well, it's really, when we do our training, we whether you do aesthetics or not, you're going to be comfortable working in the face, which is really a high stakes aesthetic area because, your face is always exposed. It's not the type of thing that you can hide behind clothing. Nobody walks around with a ski mask on all day. So your face is going to have a lot of exposure. So even from the beginning, when we're doing parotid surgery or if we're doing surgery on the face, we have to make incisions or leave scars. We're always very careful about where those are left and how they're closed because they're going to be very visible. So even before I decided to do aesthetics as a specialty, I had a lot of comfort working in the face just because I was comfortable making incisions for those type of procedures. And a lot of the dissections are the same. When you do a facelift, you're basically doing the same dissection or, raising the same skin flaps that you would raise for a parotidectomy, which I've done quite a few of as a trainee. So the kind of builds on itself. And once you get confidence in it and you're comfortable working in that area, it's not that difficult to kind of transition over to the aesthetic side because we're trained to be careful working in the face regardless, especially in the neck as well, because people are always concerned if you do a thyroid, they don't want a big ugly scar across their neck. So you learn how to close incisions with care and with some type of aesthetic approach so that they heal nicely. And so I think that's just germane to the procedures that we do as an ENT anyway. So it just became very natural to do aesthetics on the other side of that.
Okay. Now, when it comes to the actual treatments itself, like is there any new or emerging innovations in the field of treatment that you're particularly excited about?
I think really everything is getting less invasive. I mean, surgically, we're pretty much doing the same things, but just trying to find a way to do them less, sort of stigmata as far as scars and the way that appear. For instance, facelift is going through sort of a renaissance in the last several years where people are doing techniques that are not as associated with complications or just turning out bad. You know, when you think of a facelift, if you were around in the 80s and 90s, you would remember this kind of a windswept look, or look that wind tunnel look where it looks like everything's being pulled back tight. And so that really created a bad stigma around the surgery. But in the last probably 10 years, I think there's been a reemergence of techniques that are more natural in appearance. Everything is sort of getting more of a natural approach. And that, I think, is a great thing because, like I said, you know, we have to live with these results and they're always visible. You know, I think a lot of people are really looking to look natural. They want to look like themselves. They want to look as good as they feel on the inside, but they don't want to look like a different person. So, and then I think that there's just been an increase in cultural competency among surgeons. When I was learning, there were certain techniques that were basically only taught as though you were only working on a white or Caucasian face. So there weren't a lot of articles about how to work on an ethnic nose or ethnic eyes or things like that. So I think that competency is starting to infiltrate the specialties, so people are more comfortable taking the canvas that's given to them and actually working with it, as opposed to making someone look, you know, outside of their ethnicity or having a one-size-fits-all cookie-cutter kind of approach to the surgery. So those are two things, you know, just the less invasive, more natural appearance, and then increasing cultural awareness and competency.
Got it. I want to dive a little bit deeper into what you mentioned as far as the more natural looking results, because I interviewed a lot of medical professionals across the country, and it seems like one thing that they're all saying commonly is that people are looking for more and more natural looking results. They don't want others to know that they got work done. So it sounds like that's a trend that you're seeing. But I mean, why do you think that people are moving more towards this natural looking results? Like, why do you think there's that shift there?
I think customers are more savvy now, because we've seen some very high profile examples of unnatural results, especially, you know, from my childhood. I was a big fan of Michael Jackson growing up. I'm an 80s baby. I saw it happen to Michael Jackson throughout the years. And I think that there was a time where you weren't really comfortable telling your surgeon, you know, this is how I want to look when it's done. You know, one of the things that's happened now with social media is people can bring a picture in, or a result that they want to try to achieve, or they can tell you very specifically how they don't want to look. Whereas the customers weren't as savvy maybe 10, 20 years ago. And so because we've had a lot of high profile examples of surgery going wrong, especially in the face, I think patients are more cautious of how they sort of convey their desire. And, you know, in and of itself, if you have a plastic surgery that doesn't look natural, it just speaks poorly of the surgeon and the patient, you know, because it's not reversible. And so people, I think, nobody wants to look like they went under the knife. I think that's a thing that's kind of evolved out of our specialty, is people are wanting to just look like they've had more sleep, or maybe they got their hair cut, or, you know, you want to keep people guessing as to what actually occurred. So I think that's a big feature as to why people are, you know, looking for a natural result, because they want to be able to blend back into society as though they didn't do anything major.
Okay. And on the flip side of that, you mentioned that people bringing in photos of what they see online. Are you seeing the reverse end of that, where people coming in with Instagram photos is like, I want to look like this, when it's all filtered and doctored, and it's like, you know, it's not real.
Yeah. So as you know, I mean, everyone, you know, that probably comes on this podcast or has any familiarity with facial plastics or just aesthetics in general in the last 5 years would tell you that social media has been a big boon to the industry. For good and for bad. You know, one thing is people have a more precise idea of what they want to achieve. The other side is people are using filters, and there's a lot of people who think that they can achieve a look that is as perfect as a filter, which is really not realistic. So it's really incumbent upon the surgeon to, you know, educate people about what's possible. And a lot of these filters don't even look, they're not achievable, those results. So, you know, certain apps like, you know, Snapchat, where it was really filter heavy. I did get a lot of patients that would come in and say, you know, I want to look like I do in my filter, and that's just, you know, not realistic. So
okay. Now, I want to shift tracks a little bit. In your introduction, we talked about you being one of the top 10 plastic surgeons in Georgia, which is a big differentiator. But could you talk a little bit more about what else differentiates yourself and also your practice from others in the industry?
Yeah, I'm well, first of all, I've kind of like specialized in being able to do whatever comes in the door. So certain surgeons are only comfortable with certain ethnicities or certain genders even. And I pride myself on being able to do patients of all races, all sexual orientation, gender, age, and to deliver a really quality, natural looking result. That's number one. I think that wasn't always, at least from what I can see in the community, that wasn't always the focus. And as I said, I've made a real focus on making sure that patients with ethnic background are very, comfortable that they're going to stay within those boundaries. Most people don't want to change their ethnicity with surgery, but it's very possible, especially when you're talking about things like the nose, where your nose can tell basically the story of your ethnicity to a lot of people, even if they don't know your background. They can tell a lot of times where you're from just based on the shape of your nose. So a lot of people don't want to go out of those boundaries, even though they may want subtle refinement, or they may even need subtle changes to make them breathe better. The goal is to basically stay within those boundaries, and I feel like I've done a really good job of that. The other thing is I've continued to train, so I went and did some additional training in liposuction. So I do body contouring to some extent in my practice, and I started doing lipo of the neck, which has sort of been my purview, but I started getting a lot of requests to go down and do torso, abdomen, flanks, and things like that. So I went and got some additional training so I could broaden my horizons, what I could offer patients. So whether it be ear, nose, and throat, or facial plastics, or body contouring, now I feel like I provide a wide range of services that aren't necessarily all under one roof anywhere else.
I see. Now, you mentioned training kind of going after more ongoing education. Now, when that relates to your patients, like how do you approach educating your patients about the treatments, the services you offer, and the benefits? Because I'm sure you get a lot of people coming in, they think they want one thing, but in reality they need something else, or they're coming in with maybe the wrong expectations. So how do you approach that education portion specifically for your patients?
Yeah, I think it's, the main thing I do is, I was a teacher in a former life. Before I went into medical school, I was actually a biology teacher here in Atlanta as I was preparing to get into medical school. So I'm very comfortable breaking things down into layman's terms. I think that's very important. Anatomy is very mysterious to people, especially in the face, because, you kind of don't know what's behind those areas as easily as you would, other parts of the body. So I have to be very good at conveying what can happen with different treatments as it relates to the anatomy and explaining the anatomy. So I usually take the approach of listening very carefully to what they're trying to achieve, and then giving them the various options, whether it be non-surgical or surgical, or if it's device-based, how each thing is going to translate to changes in the anatomy. So I love being in teacher mode, because I think the better educated your patient is, the better they're able to make the right choice. And it definitely helps satisfaction at the end of the day, because if they know exactly what they're getting into, they're more likely to be satisfied.
Yeah. Now, I was kind of talking about people coming in with the wrong expectations or kind of the wrong ideas. What are some common misconceptions you hear about the treatments that you provide, like the most common ones? I think we've talked about a couple of them, like, oh, I want to look like my Instagram filter. It's just not possible. But what are some other common misconceptions you hear?
I think one of the main things in my specialty is just people overestimate the impact of non-surgical treatment. A lot of people really want a surgical level result, especially as it relates to fillers. I find a lot of people that come in for fillers, especially in the lower face, will say, I want my face to do this, or I want to do this with my fillers. And that's more of a surgical result that you would achieve with a facelift, right? So educating people on what's possible. Most people want little downtime, they want little pain, and they want surgeries that, or procedures that aren't gonna, sort of require a lot of, dissection or a lot of work. But, when sometimes their result, what they're looking for is not congruous with the procedure that they're selecting. So most people would choose to do something less invasive, less surgical, but the result that they're looking for is purely a surgical result. So I think the main thing is just letting people know the limits of things like fillers and Botox, and where surgery can accomplish those goals where maybe the non-invasive treatments can.
And how do you find most people take that when they come in with a certain idea and then you bring them down to reality?
Yeah, it's not always a lot of people are surprised because I think they're being misled. There's a lot of the sort of minimally invasive treatments that are overselling the effects, like Botox, I think is widely oversold. And I just think people aren't really that aware of what exactly these treatments do. So I think one of the first things I do is just educate people on the difference between surgical and non-surgical. And most people, not a lot of people will go on to surgery after that, but a lot of people will walk away saying, man, I didn't know that I couldn't do that with filler. I didn't know that Botox can achieve that. So I think we're just still educating the consumer alongside with the manufacturers about what's possible and kind of bringing people down to reality.
Okay, that's great. Again, like going back to the education, it's people coming with misinformation, then you as a professional, it's not about just trying to sell them. It's no, like this is what is required, this is what it takes, and making sure that they stay on the right path.
Right.
So now I want to dive a little bit deeper into chronic sinus issues. Actually, one of the people in my company deals with this. Like every time like the seasons change, he just has these sinus issues. So could you talk, number one, what is chronic sinus issues, and number two, like how do you help people fix it?
Yeah, so I'll kind of break it down a little bit. So sinusitis is inflammation of the lining of the sinus cavities that can be either rooted in allergies, which is a very common reason, or it could be from a bunch of sort of upper respiratory infections stacked upon each other. And once the openings of the sinuses are swollen shut, either from either one of those causes, the mucus backs up, and that mucus serves as a reservoir for infection. And so patients will develop headaches, facial pressure, dental pain, cough, postnasal drip, other symptoms. And the chronicity, or what makes it chronic, is when it's been present for more than 3 months in spite of treatment. So if you've had an infection that seems like it gets a little bit better and then it comes right back, or you take a course of antibiotics and it doesn't seem to clear up at all, and it lasts at least 3 months, that would be considered a chronic sinus infection.
Okay. And is there like a common approach to fixing it, or is it just a very case by case basis?
Yeah, there are different tools. Obviously they go sort of along a ladder from least invasive to more invasive, beginning with managing allergies with either antihistamines, nasal sprays, antibiotics, or even rinses of the sinuses like a neti pot or a sinus rinse. And when those seem to fail, then the next treatments are either surgical to dilate the openings of the sinuses and clean out the infection, or to do a full surgery where we actually have to go and create openings to let the sinuses drain more effectively. And most patients are able to treat them, non-surgically, but there's a percentage of patients that have severe enough allergies or even potentially polyps that can block the sinus drainage and have to be removed. And so those are the patients that would need surgery.
Okay. Now, for this type of treatment or surgery, or even for the other ones that you provide, what role does creativity play in your approach? Because I think when people think about medicine, they think, okay, there's a process, there's a procedure, step by step, you follow this, this, and this. But where does creativity come into play?
Yeah, well, not everybody's sinus disease is created equal. There are some patients that have underlying medical conditions, whether it be immune system disorders, or if they have a severe allergy that causes them to grow polyps, then obviously those patients would be treated differently than someone who just had a regular bacterial sinus infection. And so it really depends on the underlying cause. Some patients are going to need one round of antibiotics and they're clear, or other people are going to need a combination of antibiotics and steroids and antihistamines. Other people are going to need multiple surgeries. And then there, as we've gotten more advanced in our treatments, we've actually started to develop compounded solutions where some people may opt to go with a medicated rinse that actually has a combination of different things embedded in it. So rather than taking medicine by mouth, actually doing a topical treatment with a rinse or something medicated, which is starting to get a little bit more sort of advanced. We have a lot of different options, but some patients are going to need different combinations of those. So knowing which is going to work on which patient is really the source of a lot of what makes a doctor successful, and having creativity among the different regimens and the different treatment options is also good. I'm also a person who really believes in naturopathic treatments. If patients have found success with things that are not necessarily sort of like co-signed by Western medicine,
Mhm.
but they find it works. I've had patients that try acupuncture, for instance, and they find that that helps with sinus headaches. So I'm open to a combination of procedures, medicine, surgeries that will definitely get the job done. That's the
Yeah,
most.
yeah. It sounds like you're looking for what's the end result. As long as you get to the end result, the path there may not be the same for everyone, but it's how can we find a better way?
Right.
How can we get the end solution for the patient? It sounds like.
Yep.
Okay. Now, I'm sure that throughout your experience, you've probably run into some particularly challenging cases. So could you talk to me about one case that was just really tough that you worked on and how you were able to get a successful outcome in the end?
Yeah, I've had some interesting reconstructive cases. I do quite a few, patients that have had skin cancers removed via Mohs surgery, and they have to come in and, we have to work with the tissue that's left behind to try to reconstruct it, especially the nose. The nasal skin is very limited, and there's very limited available tissue outside of the nose that we can use to either rotate into the nose to close defects. So I would say probably my most challenging cases are usually skin cancer removal, follow-ups after people have had Mohs surgery and they're left with large defects of the face that we have to try to fill with other tissue, or we have to wait and see if Mother Nature will fill it in naturally. So I think those are probably my most challenging cases, are the skin cancer reconstructions of the face, because of the tissue is very limited, but also people are still very interested in having their previous look restored and looking natural. So
Mhm.
tissue availability is a big concern in those cases, and you got to work with what you have, and sometimes that requires extreme levels of creativity.
Mhm. Are you finding that there's any innovation in that area that might be able to make that procedure, I guess the end result of that, a little bit better or a little bit higher chance for overall satisfaction?
I would say that there are some tissue substitutes that are being used, especially for defects that are not necessarily going to be exposed. I don't think any of that has found its way into the face quite yet, because obviously we're looking at you know skin, and people really want a color and texture match with the skin of the face. If if it comes from another part of the area that doesn't get enough sun, you're going to have mismatches in the color, maybe even the texture. You may have hair on an area that you remove skin from another place and put it on the face, and then they've got hair growing in a place that they didn't have it growing before. So I think we're still working on ways to make the tissue look natural in the face. The best thing is to replace like with like. That's kind of one of the mantras of reconstructive surgery. So when you're dealing with the face, you really don't have a lot of options that would still look good or look presentable. So we're still, hopefully in the next maybe 10 years, we'll have something that is a lot more easy to work with, that replaces that tissue of the face with similar texture and thickness and color and things like that.
Okay. Now, kind of more broadly, where do you think the future of facial plastic surgery is going?
Oh, that's a good question. I would say if we take the last 10 years, we're definitely going toward a more natural looking result. We're going toward a more ethnically congruous result across patients. We're able to service a lot of different patients and keep them looking like themselves, which is really great. When I started, as I mentioned, I just remember the horror stories, of plastic surgery going wrong. You remember the facelifts that looked really ridiculous, or the nose jobs that just didn't seem to fit. And I don't see as much of that anymore. So I think we're getting a little bit more competent working with different patients of different ethnicities. And I think obviously with everything else, everything's going less invasive. So we may not need to use scalpels or other options to open up incisions. We may have laser or other things that are maybe not as, or that are a little bit more precise. And we're seeing devices that are basically getting similar results in some cases to surgery in some instances, especially as it relates to facial rejuvenation and tightening of the skin. Things that used to require lasers and other things we can actually do without having to pierce the skin and even leave scars. So I think in the next 5 to 10 years, we're going to see more of that.
Okay. Now, scar procedures.
Scarless
Oh,
procedures.
scarless procedures. Okay. Now, kind of going in that same vein, how much do you think the advent or the acceleration of technology, and even to a certain extent artificial intelligence, is going to change the industry?
Oh, that's a good one. I actually I did a course in artificial intelligence because it's another thing that I'm just interested in. I'm a super nerd. Like any new trend that comes along, I try to figure out how to incorporate it in my practice. So I did a course with Cornell University in artificial intelligence strategy. And one of the things that I see immediately is analyzing facial features and sort of rendering surgical results through simulation. So being able to scan a patient's face and sort of depict what things are going to look like after the surgery based on their request. That used to be something that we used to have to do manually with face, taking a picture and using Photoshop or one of those apps to try to actually make things different. I think AI is going to be doing that for us whole scale. And that's going to be a real blessing to busy surgeons that don't have the time to go and sort of touch up a photo for a patient. I think artificial intelligence is going to be handling a lot of that.
Okay. And for that artificial intelligence, do you think it's going to be more for the patient like satisfaction, like, hey, this is what you could potentially expect? Or are you also seeing applications to actually performing the procedure with more precision or more accuracy or anything along those lines?
Yeah, I think we're probably a ways off from surgery. I would say we've had robotic surgery for a long time. We've had programmable surgical devices for a long time. I think getting people over the threshold of trusting a non-human to do a surgery on them is probably a little ways off. But especially in aesthetics where it's really a high stakes game of the before and after really matching up with the patient expectation. So we probably are going to need a long time to do clinical trials of surgical robots or surgical decision making in AI. But I think as far as creating content, creating realistic before and afters, teaching patients, those type of things is going to be a good tool in the hands of the right surgeon that knows how to use it.
Got it. Okay. Well, Dr. Fletcher, I have one last question for you, but before I ask it, I want to point people to your website at www.aaronfletchermd.com. Now, last question is, what is the most important piece of advice you can give to someone who's thinking about getting a facial procedure done, but isn't sure which provider to choose?
Yeah, well, it's not like shopping for clothes or shoes or anything like that. You got to really do your homework. There's a lot of doctors who, and this is probably a trend across medicine, who are non-aesthetic trained or non-plastic surgery trained, who are trying to get into the industry because it's, lucrative and it's a way to make cash money in medicine, whereas most practices deal with insurance or third-party payers. A lot of doctors are starting to creep into aesthetics and maybe the qualifications aren't there or the training isn't there. So I think it's important to do your research on the training, look up, before and afters, look up, sort of reviews of the doctor. And you can also go to the State Board of Medicine where they practice and see if there's any complaints or complications, things like that. Those are important things to do, especially when you're dealing with the face, because you don't really get a chance to do that over again in most cases. And there's also a trend toward people wanting to save money, and so they're going either out overseas or they're going to people that are not necessarily qualified to try to save dollars. And I think that's something that is you have to be very careful of. You get what you pay for, just like anything else. And the good surgeons are going to rise to the top through their results, through their before and afters, through their reviews. Even though a lot of that stuff can be, I've heard about a lot of people faking that stuff. I think when it all connects, that's when you kind of know. And then obviously your gut instinct, if you go in a consultation and you feel like maybe there's something off, then get a second opinion, before you put your money down. Make sure you look around and research and see, if they've done what you're looking for at a high level. So if you're getting a facelift, make sure you look at their before and afters, ask them to show you what they've done and how many they've done and how many complications they've had. I think that's just part of being a savvy consumer in this industry.
Got it. Well, there you have it. Dr. Fletcher sharing his expertise. Now, Dr. Fletcher, where can people contact you in your practice?
Yeah, so you can look me up on my website. As you mentioned, aaronfletchermd.com. I actually do take direct consult, direct consults through the website. I'm also on Instagram at aaronfletchermd. So you can see before and afters. I do respond to, business related DMs. If you have questions about a procedure, or I also do virtual consults for patients too. So if they're out of town, I get a decent amount of patients that come from out of town that just want to get in front of me and ask me, is this right for me before they fly all the way out? So I do offer that. And so, yeah, I would say those are the best options.
Got it. Well, thanks for being on the show and sharing your message, Dr. Fletcher.
Thank you, sir. Appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.